All right, so step one in releasing the quads, we want to release the uppermost layers, specifically the rectus femoris muscle, which is, like I mentioned in the video, is a part of the hip flexor complex. And to be able to get to that muscle, we are going to be sitting in a chair to do so. And you're going to want either the flat head attachment that has kind of like these springies in it, or you want the flat head attachment that has the stainless steel top. Either flat head attachment, if you're using the mini, the flat head attachment with the mini, that's fine as well. Um, or whatever attachment feels best to you. I'm going to use the silver head attachment. Go ahead and insert that into the integrator. I'll turn sideways here so that you can see me from the side. And so you kind of want to scoot, so that you're sitting in a chair kind of in a slump position. Yeah, the guy who talks about posture is requesting that you slump. Kind of funny. So go ahead and turn on your integrator. And with this integrator, it's very powerful. So I'm only going to have it on a speed of 3. So what we're going to start is, if you feel kind of on your hip here, the bone in this area right here, and then to your kneecap, if we dissect the leg you know in half here in this lengthwise, what you're going to see is that that's the that's where the muscle lives, the rectus femoris muscle, the hip flexor muscle. The only one of the quads is hip flexor. So just coming right here into this position. You can hang out here for about like 30 seconds to a minute. And you notice how I'm just kind of lightly holding the gun. I'm not pressing down. And I'm just kind of going back and forth like this a little bit right here. This is roughly about where the tendon is. Right here is where that bone is on my pelvis. And if I go right there, that's the tendinous junction. So that tendinous junction is a really important junction because there's a lot of sensory nerves in that junction, and we just want to be able to confuse those nerves so it lets go of the muscle. All right, so we've been here for a little while now. You can always pause the video and hang out here for a little bit longer. I'm going to move on, and now I'm going to go down to the other tendinous junction of the rectus femoris down here. And again, look, I'm just kind of balancing the integrator here. I'm not pressing down. It's the vibration that we want. And I'm going to hang out here for about another 30 seconds. Feel free at any time to pause the video and just hit these areas, for 30 seconds to 1 minute to maybe even 2 minutes. Just kind of hang out here, kind of circle it like this, maybe a little bit, just these little tiny circles as you go. You can switch hands if the arm gets tired. Okay, now what we're going to do is we're going to come up back to this area up in here. Now we're going to angle the integrator so that we're going at an angle across like this. So it's at this angle, and I'm pressing here, and I'm going to kind of go up and down my leg here, and I can feel as I kind of push across, we're going to go in this kind of cross fiber manner down like this. So what we can do is you can just go across like this and just kind of work your way down like so, and then back up if you want. Or you can just hang out and kind of press slightly at an angle. And again, I'm just kind of using the weight of the gun to kind of press at this angle. So if I switch positions, you can see it from the front. I'm at this angle here like this. So I'm holding the gun at this angle. You can even hold it upside down like this if you want. And I'm just kind of balancing it here, and it's just going right into my tissue, and it's creating this cross fiber vibration into the tissue. And so what this does is it kind of peels that muscle off of that lower quad muscle, the intermedius muscle that's hard to get to, and that muscle is very thick and has a lot more tendon in it than it does actually muscle fiber. So we just go ahead and just kind of sit in there and hang out on these spots for 30 seconds to a minute, and you just slowly go down all the way down to roughly just above the knee. Okay, then once you do that side, go ahead and now you do the other side. And again, you look for that spot that has some slight soreness in it, And if it has that soreness in it, just kind of hang out there for a little bit. And again, this angle is important. This is why I'm using the flathead and why I like the flathead, because it kind of gives it a little edge. It kind of grabs it and kind of pulls the tissue over. And that's really good for kind of getting muscles unstuck, because a muscle, like specifically the rectus femoris, and a lot of other muscles do the same thing, whereas they'll get stuck on top of another muscle and or kind of adhere to it, and getting it off of that, or peeling it off, so to speak, is a good way to actually restore function to that muscle or both muscles or multiple muscles and range of motion. All right, so now that that's basically a rectus femoris release, what you're going to do, we're going to go over and work with the vastus lateralis muscle, which is, if I contract my quads here, it's this outside muscle here. So you can see the lower part of it is here. The IT band crosses right here. That's what this is the IT band. We kind of want, you don't really want to do too much on the IT band because you can't really affect it. You actually have to affect the musculature up here. Check out the IT band video if you want a good protocol for that. So getting behind the vastus lateralis muscle is a key area to work. So you can just kind of start right here, and you notice that I'm kind of not going directly vertical with the integrator. I'm going more at an angle here. So if I come from the front, you can see kind of this angle that I'm at, like so. And then I just run up the leg like this, hang out back here. Again, you're looking for that semi-sore spot. If you need to use both hands, that's totally fine. But again, you notice that I'm not sitting up really straight because I actually want the pelvis to tilt back. This allows the quads, and this position with the leg bent allows the quads to be in more of a stretched position. All the way up. And you get all the way up right, almost, here's the hip bone right there. If I get right behind it right there, that gets lower end of glute maximus as well, but we're getting this whole vastus lateralis, or the lateral quad, or the outside quad. Then you can come from the top and kind of think of you're kind of scraping down a little bit like this. Yeah, I'm pushing down with the integrator, but I'm allowing it kind of go across. And again, if you want to just kind of hang out here, find a spot and hang out, you're more than welcome to do that. And again, please feel free to pause the video at any point in time that you're doing this and kind of work these areas along with me. Okay, just be careful when you get down to this lower part. It's going to be a lot less tissue here, so it's going to be closer to the bone. It's more sensitive. Just be real careful there. Okay, so that's the vastus lateralis release. Now we want to release the vastus intermedius muscle, which is this muscle here. And to do so, I would just rotate your leg out like this, and then kind of come here, and you can go across like this, and it goes more up into this area right in here. You don't want to go down in this area. That's adductors. So this area kind of brings it up through in here is where you want to go. So here you can just go cross fiber like this. A little harder to find the edges on this muscle. But if you want to, you can even come here and kind of press down like this at the top, or come up from the bottom. That feels pretty good right there. And kind of come up across like so. Okay, and to go through that, generally you can count on it being 30 seconds to a minute in each area, and that's it for the upper layers of the quad muscle. Next, we'll do a different position. that you can access them in. All right.